Hi, my name is Katherine Parker, and today I'll be talking about the epidemiology and control of HIV/AIDS in Ireland. This is a bit of a background about Ireland. So it's an island and covers about 71,118 square kilometers, and they have a population of about 5,351,681 people as of 2024. And it's divided into 6 health regions: HSE Dublin and Northeast, HSE Dublin and Midlands, HSE Dublin and Southeast, HSE Southwest, HSE Midwest, and HSE West and Northwest. And these health regions are a combination of urban and rural areas, and about 56.8% of the population lives in the rural areas. And Ireland's considered a high-income country with high levels of human development. So Ireland has a Gini coefficient of 0.282 over 1, so that means that its income is spread pretty evenly throughout its population. And the life expectancy at birth is about 82.9 years, and cancer and cardiovascular disease are the leading causes of death in Ireland. So this is some of the background of the outbreak in Ireland. So the first case of AIDS was identified in Los Angeles in California in 1981. Then the following year, Ireland had its first HIV/AIDS case diagnosed. And the first HIV infections in Ireland were contracted outside of Ireland. And it's also important to note that homosexuality was illegal in Ireland until June 24th, 1993. And the Roman Catholic Church strongly influenced Irish society since the mid-1800s and continued to influence and be involved in education in Ireland. There were 695 cases of AIDS reported in Ireland from 1983 to 1999, with 51% having died as of the year 2000. And from 1994 to 1999, new HIV rates tripled, while the cases of AIDS decreased during the same time, which is attributed to the advancement of the HIV treatments, preventing the HIV infections from progressing to AIDS. And then from 1983 to 1999, injection drug use was the most common mode of transmission at 40% of cases, followed by men who have sex with other men at 34%. So now we're going to talk some about the methods of surveillance in Ireland. So HIV has been a notifiable disease under the Infectious Diseases Regulation since 2011, and the National Disease Surveillance Center took over AIDS reporting in the year 2000, and the National Virus Reference Laboratory does all confirmatory testing on all new HIV diagnoses. So clinicians complete an AIDS surveillance report form, which collects patient demographic information, the probable route of transmission, and what disease the diagnosis of AIDS is being based on, and that's submitted to the National Disease Surveillance Center, and they compile all that data. So overall testing patterns are monitored, but testing patterns by specific risk groups are not available at this time. So there were 337,626 HIV tests performed in 2024 in Ireland, and there were an additional 71,662 home HIV tests that were completed that same year. So in the case of both these tests, more females than males were being tested, and the voluntary antenatal HIV testing also occurs, with 74% of positive HIV antenatal tests being among pregnant women who were already diagnosed with HIV. So now we're going to talk about the current epidemiology of HIV/AIDS in Ireland. So approximately 7,200 people are currently living with HIV in Ireland. Compared to the UK, Ireland has fewer people living with HIV. The UK has about 111,800 people living with HIV. So 239 new first-time HIV infection diagnoses were made in 2024, with a prevalence rate of 18.8 per 100,000 people. So compared to the United Kingdom, they have a prevalence rate of 160 per 100,000 people. So Ireland has the lower prevalence rate. They also have a lower incidence rate than the UK and to the European Union in general. So the incidence rate of HIV in Ireland is just 4.6 per 100,000. In the UK, that's 6.7 per 100,000. And in the EU, is 6.2 per 100,000. And the age-adjusted mortality rate from HIV is 0.15 per 100,000 population in Ireland, while the UK has a slightly higher mortality rate of 0.196 per 100,000. So in Ireland, males living with HIV have a higher prevalence rate than females, The males have a prevalence rate of 23.3 per 100,000, while females have a prevalence rate of 15.1 per 100,000 people. And except for the 45 to 49 year age group, males have the higher rate of HIV per 100,000 than females. And in the table, you can see the prevalence rate of HIV for males and for females in the table. So continuing with the current epidemiology, the majority, so 76% of HIV diagnoses are in those who are born outside of Ireland, with the highest rate being from people who are in Ireland from sub-Saharan Africa, and they have the highest rate at 587.7 per 100,000 people. And 9% of the total HIV diagnoses come from those born in Ireland, and that rate's been stable since 2012. And the current predominant mode of HIV transmission in Ireland is now gay and bisexual men who have sex with other men, which accounted for 41% of the first-time HIV diagnoses in 2024 and 35% of the total number of HIV diagnoses. Then heterosexual sexual contact is the next most common mode of transmission, with heterosexual women making up 28% of the first-time HIV diagnoses and 29% of the total HIV diagnoses, while people who inject drugs make up 2% of the first-time HIV diagnoses in 2024 and just 1% of the total HIV diagnoses. So Ireland has implemented preventative measures, and we're going to talk about the current preventative measures that they have. So in 2015, the National Condom Distribution Service began, and this made condoms and lubricant available at all STI and genitourinary clinics. And since 2021, home HIV and STI testing has been available from SH24. So these home tests are discreetly delivered, with the test results being available through text or phone call, depending on the person's preference. And there's also pre-exposure prophylaxis medication that's been available in Ireland since December 2017. And there's also post-exposure prophylaxis HIV medication that can be accessed at many STI clinics and in emergency departments for those who may have been exposed to HIV to take to prevent a potential HIV infection. And HIV and STI information is available online, including information about prevention strategies on the website Man to Man. In 1989, Ireland introduced a needle exchange service to areas with high rates of substance use, and then expanded it to other areas of the country in 2011. So these needle exchange services are free and confidential. The only information they collect is the date of birth and the initials of the person accessing the needle exchange service, and that's collected by the pharmacist. And in exchange, they're given sterile injection equipment that includes a clean 1 milliliter needle with syringe, an alcohol wipe, citric acid, a sharps container, condom, spoon, and also information on how to inject safely. So historical measures that they had in place. So at the start of the epidemic, the Gay Health Action, or GHA, was the first organization to make information leaflets, which contained information about AIDS, HIV, and how it was spread. And they used very sexually explicit, unambiguous language to describe the different activities and the risks associated with each, which was a huge shock to the Irish people. So the Health Education Bureau, or the HEB, supported the leaflet financially and was met with opposition because the GHA was seen as violating the Censorship of Publications Act of 1929, which had a prohibition against sexual health promotion or infection treatment advertisements of any kind. So after the GHA leaflet controversy, the HEB in 1986 developed its own AIDS information resource with less explicit details, and they only referenced it as unsafe forms of sexual activity, and they did not explain what that would actually entail. And that was part of the first national AIDS awareness campaign, which promoted sexual abstinence and monogamy in marriage. And the first AIDS information leaflet by the GHA was significant because it moved Ireland away from a culture that talked about sex in unclear, vague euphemisms to being more clear and explicit in how they talked about it. There are barriers to HIV/AIDS control in Ireland. So stigma is experienced by 64.8% of people living with HIV, with 59.3% of people living with HIV agreeing that living with HIV impacts their mental health. Then there are other barriers like the lack of clinic space, large catchment areas, travel burdens, and socioeconomic burden. And then clinicians and clinics have also reported relying on non-governmental organizations to provide formal counseling to people living with HIV. So they're having to outsource the counseling part to other organizations. It's not something that they can provide at the current time. Despite the barriers to care, Ireland's been pretty effective in how it's worked to control the HIV/AIDS outbreak. So Ireland was in a difficult position at the start of the HIV/AIDS epidemic because homosexuality was illegal and the country was mainly Roman Catholic and conservative. So they did not think that HIV was going to spread to Ireland originally, so they didn't take it as seriously as they should have. So the government, not wanting to upset, the majority of voters that were Roman Catholic and conservative, underreacted to the epidemic, and they could have done more to mitigate the harm that the spread of HIV was doing. So the slight financial support of the GHA and their information leaflet about HIV and AIDS was a good first step. And then the first official leaflet from the actual government needed to have used more explicit language, detailing more precisely the risks of certain sexual acts and behaviors. So more recently, the establishment of the voluntary AIDS surveillance reporting system and the subsequent reporting of HIV cases were good steps to begin tracking the outbreak and its spread through Irish society. And the information about HIV/AIDS available online through Man to Man and through the HSE that's from the Irish government and is specific now in the risks of certain activities, and information on ways to mitigate those risks are also available on those websites. And the barriers to care can make it difficult for some, especially in rural areas, to access testing and preventive measures such as PrEP, which is part of why having the home testing service is so important. And then the Irish government should investigate ways to expand services to rural areas and continue to employ the HIV and STI testing measures that began in 2021 through the SH24. Now I'm going to talk about the design of an HIV prevention/control strategy. So Ireland should consider a safer sex campaign targeted to heterosexual females. So heterosexual females are contracting HIV at faster rates than in the past, suggesting that safer sex practices are not being utilized. So I think a social media campaign targeting heterosexual Irish women could help inform this population of their risks of contracting HIV and how to navigate minimizing their risks. And the information included in the campaign would be where to get free condoms and lubricants, where to access PrEP and PEP, and HIV testing options such as the clinic options and the home testing program. And these are the references that I used. Thank you so much for watching.